In the mid-1990s, insurance companies made a decision that would transform American healthcare. Claims departments would no longer be service centers. They would become profit centers. A strategy emerged. First, delay investigating claims as long as legally possible. Then, deny payment. And finally, defend that denial aggressively in court. From TalkoCast Studios, this is Delay, Deny, Depose. I'm Jonny Llama. Before we begin today's episode, I want to thank you, our listeners, for making us one of the top 50 true crime podcasts in America. Your commitment to understanding this complex case has created a community dedicated to uncovering truth through verified facts and documented evidence. Today, a former UnitedHealthcare employee steps forward with explosive allegations about systematic denial training. Meanwhile, court documents reveal a shocking statistic. Over 90% of denied claims are overturned when appealed, but only 0.2% of patients ever fight back. This is the story of how 3 words inscribed on bullet casings, delay, deny, depose, connect to a corporate strategy that transformed American healthcare into what one legal scholar calls systematic profit machines designed to exhaust patients into giving up. In the mid-1990s, McKinsey & Company approached major insurance companies with a revolutionary idea: transform claims departments from service centers into profit centers. The numbers are staggering. Hospitals spent $10.6 billion last year fighting denied claims that should have been paid. Meanwhile, UnitedHealthcare's revenue reached $281 billion, affecting 49 million Americans. But behind those profits lies a system that former Washington State Insurance Commissioner Deborah Sen calls systematically and deliberately squeezing America's consumers.
I worked in the medical claims department and went through training for about 2 to 3 months to get out on the claims rep floor.
This is Natalie Collins, who worked for UnitedHealthcare for 9 months, in an interview with News Nation.
Every policy is completely different, so there was medical jargon in each policy that led us to have to follow these procedures, but more or less we would have to just get the client off the phone as fast as we could, and then if they weren't liking what we were saying from the script, then we would just call a supervisor and they would stand behind us, and while I was crying, they were laughing.
Natalie said in her interview that staff received so many different ways to deny claims during their 2 to 3 months of training, with supervisors often standing behind representatives instructing them on denial methods.
But yes, if there was things being said or lots of phone calls being placed by the same caller, then supervisors would be behind us, instructing us to tell them certain ways to deny it or just to get them off the phone.
Tell us more about this, because you say there was one specific hospice claim in particular, a widowed woman who called you. You say her husband had passed from pancreatic cancer, left her with 5 boys. And you say they, quote, told me every which way to deny this woman to get her off of our phone line. Tell me more about this case. You call it despicable.
They just wouldn't allow me to submit the claim. There would be alerts on each claim telling us that either we had to put it back in our queue and it would just go to someone else 30 days later, 60 days later, however they had it set up. And then we would have to manually go in and try to find that claim. And that's what I ended up doing, was to go in there and find it and pay it myself.
An October Senate investigation revealed shocking findings. UnitedHealthcare's denial rates for prior authorizations among Medicare Advantage patients had surged. The company's strategy, according to internal documents, was to make the claims process so expensive and so time-consuming that lawyers would start refusing to help clients. The strategy works like this. If claimants accept the purposefully low initial offer, they receive speedy service. If they don't, they face delays and are forced to file suit. Meanwhile, their medical bills pile up, their credit scores plummet, and desperation sets in. Most disturbing is how giving up gets reframed. When patients abandon their claims due to exhaustion, companies label these as fraudulent claims that were rightfully denied.
The longer they can delay and deny the claim, the longer they can hold on to their money and they're not paying it out,
said Leah Keller, managing partner at Lewis & Keller, a North Carolina-based personal injury law firm.
All insurance companies have an incentive to chisel their customers in order to increase profits.
By delaying payments, insurance companies could invest the float, the money held between premium collection and claim payment. Meanwhile, their computer-driven models would output purposefully low offers. The results were staggering. According to industry reports, profits doubled after implementing these strategies. Strategies that systematically drive down payment values to 30% below actual market costs. As legal scholar Jay Feinman notes, this isn't about cheating customers here and there. It transforms the claims process into a profit center. The new corporate culture worshipped growth and profit above all else, while intense price competition drove increasingly aggressive denial strategies. An October Senate investigation revealed doctors' growing frustration with prior authorizations. As one physician testified, we're seeing delays that can hurt a patient's chances for recovery or even survival. The numbers reflect America's anger. A KFF poll found that 2/3 of Americans blame insurance companies for high healthcare costs. Nearly half of insured adults report being unable to resolve claims problems satisfactorily. As legal scholar Jay Feinman writes in his book, Delay, Deny, Defend, if a homeowner hires someone to paint his house and the painter never shows up, the homeowner can take his money and hire someone else. But if the insurance company refuses to pay a claim, it is too late to go elsewhere. From all of us at TacoCast Studios, thank you for making Delay, Deny, Depose one of America's top true crime podcasts. Starting today, I'll be posting daily episodes to keep up with this rapidly developing story. You can find us on Apple Podcasts, Spotify, or wherever you like to listen. Remember to visit my blog post in the description below for full source documentation and transcripts. Every fact, every quote, every document is all there for you to verify. Because in times like these, truth matters more than ever. Until tomorrow, I'm Jonny Llama.